So how do you treat patient with drug and alcohol abuse?
It depends on each patient. It's individual, but um, I ask them. I treat them like the alcohol was their medication, and what was the alcohol treating for them? Was it helping with anxiety? Was it helping with depression? Was it helping with trauma? And then try to treat that. Try to treat the depression, anxiety, and the trauma, and then encourage abstinence, maybe through AA or some type of support. But I try not to overly focus on the alcohol and the addiction.
What do you
I focus more on the symptoms that lead them to addiction.
To addiction.
So
that makes sense.
like a lot of people, I think, treat it. They just try to get people to stop drinking, and they don't really treat the
What's
real
causing?
reason why.
I see.
A lot of these drug rehabs, they set up treatment, and their model is abstinence, but they really don't address the mental health problem. Addiction is, I treat it like a diagnosis, like anxiety, like depression, like it's just another symptom
Yes.
of mental illness. And I think we overemphasize on the addiction piece of it and don't focus enough on the depression and anxiety that leads to addiction.
That makes a lot of sense.
Yeah. And you just have, I think with patients, when you treat them that way, my goal isn't to make them stop drinking. My
What's your
goal is to
goal?
help them get better.
Okay.
And if that's stopping drinking, then great, then stop drinking.
Yeah.
But, I think, one of the biggest causes of addiction is shame. So shame causes people to, shame is like the fuel of addiction. So
Right.
I really try to help them work on their shame, because it's a self-destructive behavior that makes you feel good, but it's so destructive to your body and to the people around you, and it can be really harmful.
Right.
So, and take it just one patient at a time,
Right.
and you just never know what's going on with somebody, and I'll have patients who, it's not about, I don't want to set up a situation where, now listen, if somebody's actively using and, they're not getting anything out of their treatment and they need to go to rehab, then I'll recommend that. But, I don't want, if somebody has a relapse or a slip or they're struggling with them, I don't, some therapists or some approaches of treatment are, if you're drinking, I can't work with you.
Right. Right.
And I don't agree with that, because, I've had many patients who came to me drinking a lot.
Yeah.
A lot. And, I had one patient who was drinking like a liter of vodka a day, just
wow.
around the clock.
Wow.
And he came to me, and I worked with him I ended up working with him for like 5 or 6 years, but I think it was like a year before he finally stopped smoking, stopped drinking. And, he, so I think it's, people just want the person to stop the behavior and then just be okay, and that's just not how it works. It's a long process.
Yeah.
Usually people, they don't just wake up one day and, start drinking alcoholically. It's, there was a lot that happened before that drink. There was a whole childhood. There was a whole life that happened.
You think
before.
trauma is part of it too?
I think so. I think trauma. I think genetics. I
Genetics?
think genetic predisposition. Only. It's like, it's somewhere between. It's like 5 to 10%. I think. It might be. I think it might be even less than that. I got to look at I forget the research, but it's maybe to say like 5% of people who use opiates get addicted, or it might be like 2% of people who use opioids for pain get addicted. It's, the rest don't. So it's, there is something genetic that, when somebody who is a heroin addict or an opioid addict, it changes their brain. It changes their, it changes their definition of happiness. And opioids hits the brain on like ancestral levels in a way that no other medication does. So it is a very severe addiction, but it's most of it is, I believe, genetic predisposition.
And that's
because there's a lot of people who take pain meds and they get off them and they're fine. Well, they keep them, they keep them on hand, and it's not a problem for them. But there's this small percentage that become addicted, and it's, it fools the brain into thinking that you're going to die without that.
Right.
So it's, so I think each addiction needs to be treated differently.
Okay.
Opioid addiction, cocaine addiction, alcohol, cigarettes, they're all different. They're all
Right.
very different at different parts of the brain, and different effects and different reasons.
Yeah.
And some people might be predisposed to alcohol addiction.
Right.
Some might be predisposed to cocaine addiction. They did a study about Vietnam vets who were over in Vietnam, and the big thing over there was morphine. So they just had all the morphine they wanted to treat the pain, and they could just pop it open. Well, a lot of these guys got addicted and started doing heroin.
Right.
So all these guys were doing heroin over there.
Wow.
And they were concerned about all these guys coming back from the war being heroin addicts.
Right.
And going through withdrawal, and something like 95% of them came back and never used opioids again. No problem.
Oh, wow.
They were fine.
Oh, wow.
It was a small percentage that stayed addicted.
Right.
So, I think there's a whole new discussion that needs to happen about addiction and mental health, because, what we're doing is not working. The heroin epidemic, it's everything they throw at it, it just keeps getting worse.
Right.
It's getting worse.
Right.
It's getting worse. It's not working.
Right.
The rehabs are making money, the drug companies are making money, the doctors are making money, but the patients are fucking dying.
Right.
So.
So how do you treat your patients and to help them, get out of it? What's your treatment
It depends.
approach?
Each patient's different. It's it might be some talk therapy, and it's usually medication. It's probably an SSRI.
Okay.
A lot of alcoholics have undiagnosed ADHD.
Oh, wow.
There was research. There's a research study, a longitudinal study they took two groups of kids, and they were all diagnosed with ADHD. Half of the group just got behavioral treatment, and the other half got medication. And they followed them over 20 or 30 years. I forget the exact study, and after 20 or 30 years, they went and they looked at all these people, and the half of the kids who did not get medicated had 50 to 75% increased chance of addiction, and the kids who were medicated, the addiction rate was I think maybe under 10% or something like that. So those are just facts, things that people don't take into consideration.
Right.
And they think that it's to take an alcoholic or somebody who's been using a substance to alter their reality for many years, and then to make them stop and just hoping that prayer or therapy is going to help is sometimes unrealistic.
True.
You need something in there. There's medications that help boost serotonin that are safe, not addictive. It boosts dopamine and norepinephrine that are safe and not addictive. And so I think it just goes down to treating the illness, treating the symptoms of the depression, anxiety, and I think alcohol and abuse, substance abuse, I think a lot of times is a symptom of depression and anxiety, because it's the only thing that helps people feel better.
Wow.
Because it's it can be such a lonely place to be depressed and anxious.
I agree.
And then and then you go to a bar, or you pop open a few beers, and next thing you know, you're feeling a little bit better.
Yeah.
But it doesn't last. The thing is that it doesn't work forever.
Yes.
It has. It doesn't. It's got a shelf life, and Yeah, it's just treating people the way they need to be treated, you know,
Right.
and not, you know, I think a lot of these addiction approaches, you know, it's like very cookie cutter, you know, it's like, you know, the addict has to come in and adjust to the treatment and the treatment doesn't adjust to them. So it's not really individualized.
Right,
You know, and
right,
the only
yeah.
real treatment I think that works is individualized treatment.
Wow, I would not have known you. I did not ask you about this. Yeah. So,
It's the brain, you know, it's like, that's why I like the brain, it's treating the brain.
right.
You know, the brain, you know, does everything. The brain creates our feelings, the brain creates our reality.
Yeah.
And, you know, once you start to understand that, and then you can use these medications to really help the brain work better.
Yeah.
You know, it's, you know, I've seen, you know, it's outstanding results. You know,
That makes a lot of sense. Well, thank you for clarifying with me regarding drug addiction problem and how, you know, it should be treated and what's the roots of that
Yeah,
problem.
yeah. Thank you.
Really great information.
Thank you, Jocelyn.